Hello, I'm Dr. Erich Randolph. I'm a radiation oncologist at CurePoint Cancer Center here in Dublin, Georgia. I'm glad to welcome you to this year's Healthcare Summit that is here to provide information to those who are able to listen, and hopefully it'll be a platform for further discussions on how to improve the health care of the community. And I'd like to let the meeting proceed with Mr. Heath Taylor.
I want to start by saying thank you so much for the support and the involvement with this program. And I think folks realize the importance of this program today. We had over 100 people sign up to attend this event in person, and unfortunately, due to a spike in COVID and listening to our local officials, fortunately, we can bring this event to you virtually. So we've got a great panel today that will be speaking with you and sharing information, COVID updates, anything from cancer to mental health today. But this will give you an overview of the state of health care in Dublin and Lawrence County. On our panel today, we'll have Don Avery, CEO at Fairview Park Hospital, and he'll give us an update of things that'll be taking place and things that are taking place at the hospital. We'll be welcoming Dr. Nelson, a local doctor here that'll be talking to you about COVID and health care as related to COVID. And then Dr. Randolph, a local oncologist here that'll share with us some updates and some treatments and some things going on in the world with cancer. And then Miss Denise Forbes. Denise is with the Community Service Board of Middle Georgia. For you and I, we may recognize them more by saying our Board of Mental Health there for folks that may be looking for them. But Ms. Forbes will give us an update as to mental health and the whole person today, and just where the world is with COVID and everything that's going on, the state of mental health. We've got a lot of work to do and reach out to people. And then another great friend to the chamber, Mr. Darin Keene, part owner at Clements and Keene Insurance, and Darin and the folks over there are doing a great job. They got some great plans and programs in place, and Darin's going to give you some great information to help you with your health care. Dr. Avery's going to share a little different perspective with us, is that Dr. Avery has actually not only had COVID, but near-death experience with COVID and a really long struggle with COVID. So Dr. Avery is really going to share a little bit different approach and opinions with you about COVID today. We're going to take a really quick break, and we're going to come back and start with our panel.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook. It's really hot outside, and the deals are even hotter with the City of Dublin natural gas. How would you like a free 40-gallon hot water heater plus free gas installation? It's easy. Just pick up the phone and call Brad Grimes with the City of Dublin Natural Gas, 277-5048, and get a free hot water heater and free installation. The City of Dublin Natural Gas, saving you money every single day.
All right, first on our panel today, I'd like to welcome a good friend of ours in the community here, our president at Fairview Park Hospital, Mr. Don Avery.
Hi, I'm Don Avery. I'm the CEO at Fairview Park Hospital, and I wanted to provide kind of an update on the health status here at Fairview Park Hospital, as well as some comments about the community. And the community, whereas I might focus on Dublin and Lawrence County, really applies to all of Middle Georgia. This past couple of weeks have been very challenging for all healthcare workers because we've seen the post-holiday surge in COVID-positive patients, and we've seen a pretty dramatic increase. We first began to see that in the community as more and more people were testing positive. The number of people getting tested has increased, but as a greater concern is the number of people that were positive. The positivity rate, if you will, of those people being tested has increased. To Lawrence County, that number is greater than 15%. In counties around us, it's as high as the mid-20s to the mid-30s in terms of percentage of people getting the coronavirus test being positive. And so I can't overemphasize the need to remain diligent, to recognize that this is still a very active virus, and everybody is susceptible to it. Here at the hospital, we hit new highs. In fact, we hit new highs on several consecutive days last week. To give you a comparison, last summer, at the height of the COVID pandemic, we hit 50 positive patients in the hospital, which represented probably about 40% of the total patients in the hospital at the time at Fairview had coronavirus. Last week, that number got as high as 68, and 68 of our total inpatients represented about 60% of our inpatients were COVID positive. We had to open up 2 new units so that we could isolate those patients and continue to care for other folks. And that's probably the biggest burden that all hospitals have on them, is as the number of COVID patients rises, it makes it increasingly difficult to take care of people who don't have the coronavirus, because we do keep those patients separate. It puts a huge burden on our ER, an already busy ER. Means that several people, as high as last week, 17 people were holding to be admitted into the hospital and had to stay in the ER, which meant we had overflow patients in the hallways waiting to be seen. And it's just a very stressful situation. And so again, the way to combat that is to continue doing what I think a lot of people are doing now, is not having social gatherings, continuing to wear a mask, etc. You've heard a lot about that, but you shouldn't discount it. Those are very important precautions to take. We are still able at our hospital to take care of emergencies, to take care of other patients, but it does put an awful big burden on a staff that has been working very hard. And we're short-staffed in some areas. So from that peak, though, of last week of 68, we have seen more discharges than admissions over the past few days. And today we got down to 43 positive patients, which is still a big number, especially if you're one of those patients. But again, that makes a significant kind of easing of the pressure on the staff. We still have holds in the ER. And it's difficult to transfer patients because other hospitals around the state are experiencing the same thing. The thing to know, though, is while a lot of people are getting this virus and we're taking care of those patients, not all people need to come to the ER. So I would say see your primary care doctor first. If you do come to the ER, we're going to care for you, and we want to make sure that you know that. The best thing we can do to combat this is get the vaccine. Long term, the only way to solve a pandemic is for people to get the vaccine. A lot of people will wait until after the holidays. About half of our healthcare workers here at the hospital have gotten it, and currently the only community people that we're serving and providing the vaccine to are other healthcare workers, doctors' offices, other healthcare workers in the community, first responders. We are assisting the health department in providing those vaccines here at Fairview Park Hospital, in addition to providing them to our employees and our medical staff. We provide both the Pfizer and the Moderna vaccine now. We started out with the Pfizer, and now we have both those vaccines to give. And we'll continue to do that, and in time, I think we'll probably eventually help the health department more in providing these vaccines to the general public. Currently, we are not. In Lawrence County, you can always get your vaccine by calling the South Central Health District office, looking on their website or their Facebook page. They are giving vaccines twice a week at Southern Pines, and you can call them for more information. In the meantime, I want to thank those of you, individuals and organizations, who are taking the precautions that we've asked you to take. Social clubs or civic clubs that have ceased in-person operations or ceased inpatient meetings. Thank you for doing that. I think those are wise steps. I know there's been certain events canceled to make sure that we don't create super spreader events. Many of the businesses and restaurants in town are taking extra precautions, and we appreciate that, because that's what's going to keep the spread of this virus. It has been around a lot longer than people expected, and we think it's going to continue to be here for some time this year. And so we continue to appeal to the public to do all you can do to help prevent the spread of this by not having social gatherings, by staying home as much as possible. Being outside is healthy, obviously, but again, I can't emphasize enough the importance of getting the vaccine. I've had both of my shots, and I'm doing fine. We've already had a high percentage of our employees that have gotten the vaccine, have had their second shots, and all are doing fine. And the vaccine, they say you'll have a better than 95% immunity to the virus. So again, I encourage you to do that. Thank you for all that you're doing to help us, and stay safe.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
Hi, I'm Dr. Dustin Gay. I'm a local orthopedic surgeon with Houston Clinic Orthopedics, and we'd really like to invite everybody to come out to our new office facility to take a look at it. It's a larger space with physical therapy, and we're just excited to have it, and we'd love for people to come out and visit us.
Come by and see us today at our brand new location, the Houston Clinic, Medical Drive in Dublin.
Now we would like to welcome Dr. Nelson. Dr. Nelson is going to, if you would say we have an expert on COVID, a doctor in this community, Dr. Nelson would be the person that we would like to hear from. Dr. Nelson, welcome.
As you're probably aware, COVID is quite busy in this community, and as it is in most of Georgia right now. Over the last several weeks, we have been as full, if not more full than ever. Thankfully, those numbers may be decreasing slightly, but still it's been somewhat of a challenge for all the staff here at the hospital, not just the physicians, but nursing and everybody involved. And so we still really urge people to try to maintain social distancing, hand washing, wearing masks. It's disheartening to see people who ignore this because they think it doesn't matter, but it makes a tremendous difference. Many of our patients now are related to visitations at the time of Christmas and at New Year's, and of course that's a very understandable time for family gatherings, but unfortunately it's also a time of high transmission of this disease. So we encourage people to still socially gather. Just because a few people in the community have had the vaccine, that's not enough to protect us. Moving on to the vaccines, we have two available now. We have one made by Pfizer and one made by Moderna. And these appear to be highly effective vaccinations. Really, there's only one other vaccination that probably is more effective, and that's measles. So it's a tremendous asset. Both of these vaccinations use the same kind of methodology to achieve immunity to the COVID virus. It is a sort of a new application of something that's not new, but they have been well received. They've been well tolerated. Like any other vaccination, some people have side effects, and these aren't really side effects. These are effects of the vaccine. They're your immune system being revved up in response to it. So aches and pains and occasional fever. Some people will occasionally have some swollen lymph nodes in their armpit that usually go away overnight. So the vaccinations are available. The Department of Public Health has done a wonderful job in our community of bringing this and making it available to those who are eligible to receive it. Everybody I've spoken to who's gotten their vaccination from the Department of Public Health has been very, very pleased with the mechanism and how it was done, so I'm very proud of them. We, of course, are providing the vaccination here for our employees. We also know that several other practices in town either have the vaccination available or will be soon, and I expect that pharmacies, some of the major chains, will also be vaccinating, much like they did the flu. In terms of the vaccination front, next month we should have at least one, if not two more vaccinations available. One of these, Johnson & Johnson, will probably be a one-time shot. So that'll be a benefit for many people who have trouble following up or traveling for the second shot. Make no mistake about it, we feel those who get vaccinated are helping everybody. It's going to take widespread vaccination to really bring this under control. In terms of therapeutic options, really not a whole lot of new things. There are some items available as an outpatient, the so-called monoclonal antibody therapy that most people have heard about are strictly outpatient drugs. They're not intended to be used as an inpatient. They're for individuals age 65 or older or age 55 or over who have very high risk issues that put them at a greater risk of complications of COVID. And this is certainly something given as an outpatient. And we hope to see that in the community relatively soon. Again, these aren't cures, but they do lessen the severity of the illness and may prevent some people from having to go into the hospital. We appreciate our community's support of the staff here. The support of the staff at the hospital has been tremendous from the community, and it is very much appreciated when people send cards or notes or gift baskets to the various floors associated with caring for individuals with COVID disease. It's greatly appreciated. It means an awful lot to all these workers, people who have sacrificed a great deal since last spring. So thank you to the community for that.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook. What makes Medical Park Pharmacy and Tomlinson Pharmacy different than the big chains? People. You'll see friends and neighbors on both sides of the counter. We go the extra mile, and you can always count on compassion and professionalism. If you hate going to your big chain pharmacy and waiting, then come to Medical Park Pharmacy, 2406 Bellevue Road, or Tomlinson Pharmacy, 108 Rose Street in downtown Dublin, where your prescriptions are filled in minutes, not hours. Save money and time at Medical Park and Tomlinson Pharmacies. Our family caring for your family.
Hello, my name is Dr. Manuel Vega. I've been in Dublin since February of 2004, period. I've been in medicine since 1980. I finished my cardiology training program in New York in '85 and came to Atlanta, period. I lived in Atlanta and worked in Atlanta, including at Piedmont Hospital, St. Joseph, Crawford Long, Georgia Baptist, and many other local hospitals for about 19 and a half years before deciding to come to Lawrence County, mostly to work out of one hospital. I mostly work out of Fairview Park Hospital at the moment, period. I'm board certified in all the cardiology boards that a cardiologist usually has, including internal medicine, cardiology, interventional cardiology, and nuclear cardiology. So all 4 boards are under my name, and I passed them all. I've been practicing mostly preventive and invasive cardiology. I'm of the old school, and I believe in complete care of the patient. This is different for some of the new graduates who are actually only interested in putting stents and sending the patient for procedures when they actually do not try the complete appropriate treatment. As a matter of fact, the government is making new guidelines in 2018 requiring that the appropriate utilization and treatment of patients before they undergo procedures, which I do most of those, but the emphasis is on medical therapy, what we call optimal medical therapy or guidelines-driven medical therapy, and that is going to be the big news starting in January. An example, the other day I had an elderly lady about 85 years of age who was referred to me because she had an abnormal stress test that was done at her family doctor's office, and she was not taking any medicine, and she was referred for a cardiac catheterization. Well, that's I consider inappropriate since the patient was not taking any medicines under the guidelines and under logic. The emphasis is on treating those patients with medications, and only if they fail medications would you then proceed to possibly further investigation, such as a cardiac catheterization or the need for a stent, which I do, or the need to send the patient for a bypass surgery at a tertiary center. That's going to be the big difference starting probably next year, because most physicians have fallen away from preventive medicine and mostly are geared to doing a test and trying to fix that with a procedure. As a matter of fact, just as a matter of reference, prior to 2004, it's only 15 years ago, we had no actual guidelines on treating patients with medicine. So if you had what we call chronic ischemic heart disease or chronic blockages and you had no symptoms, your chances of dying were about 4% a year. And it wasn't until a simple study in 2002 was done that they found out by lowering the cholesterol, by taking a baby aspirin every day, by taking a small amount of beta blocker, you cut down the mortality by half to 2 in 100 instead of 4 in 100. Just simple things like that. Now, since then, we've had significant guideline changes on how to manage cholesterol, how to manage diabetes, how to manage blood pressure, and they're all driven by guidelines and accreditation bodies who actually recommend what we call evidence-based medicine, what actually works in the majority of the people. And that's how medicine, I think, is changing in the very near future. The chronic heart disease patient who doesn't necessarily have much angina needs to be treated with medical treatment and treated aggressively to slow down the progression and probably slow down the need for further investigation. This is different from the patient that a lot of times I see in the hospital where they come in with unstable chest pain, and those are the ones that need emergency catheterization or emergency procedure. But I think the biggest loss right now is that most physicians are not aggressively evaluating patients for what we call silent myocardial ischemia. That means that you're having areas of your heart not getting good blood supply, but you're not having chest pain. And for situations where you have all these risk factors that are not well controlled, especially here in the Southeast. When you count diabetes and high blood pressure, the Southeast, there is a significant number of patients which both of these two factors are not controlled, which increases the number of vascular disease. As a matter of fact, this is the haven for cardiovascular diseases, the Southeast. So I just wanted to introduce myself. I like to make these talks and answer questions concerning how changes can be done to improve the quality of life. Like I stated before at the beginning, I'm an interventional cardiologist. I have my boards. I do the majority of the stenting and the catheterization at Fairview Park Hospital, but there are indications. Not every patient needs a catheterization, not every patient needs a procedure, but every patient with risk factors such as diabetes, high blood pressure, high cholesterol, smoking, does need to probably be on medical treatment and does need to modify and change their lifestyle so they can have a better outcome and a better quality of life. Talk about any subject, you know. I even could talk about the economics of medicine, but that's not a subject. But if you ever want to have one like that, I could give you one for free on economics of medicine, by the way. Yeah, I love what I do. As a matter of fact, my wife sometimes gets a little mad at me because of the hours that I put in, but it is something that it makes a difference in people's life. My work day may start at 7 in the morning and may end up at 11 o'clock at night, sometimes 6 days a week. I've never said no, even if I'm not on call, to come and see a patient, because I figure, you know, God put me on this earth for something, and if you can make a difference, and that your knowledge of, and I have almost 35 years of experience, may make a difference in that patient. So I don't have a mission statement, but my statement is go through life and touch people positively and make a difference in somebody else's life. And that's how I practice, and that's how I live.
I'm so confused. I know I heard you loud and clear, so I followed through. Somehow I ended up here. I don't wanna think, I may never understand that my broken heart is a part of your plan. when I try to pray, all I got is hurt in these 4 words. Thy will be done, thy will be done, thy will be done.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
I'm Don Carswell of Dublin Chevrolet. The new year means new savings on your favorite Chevys.
Save over $5,000 off MSRP on the Chevy Equinox.
And remember, Don sells cars well only at Dublin Chevrolet.
I want to welcome a very familiar face with CurePoint Cancer, Dr. Erich Randolph.
My name is Dr. Erich Randolph. I'm a radiation oncologist who's recent to Dublin. I originally was in Atlanta, and I've come to Dublin to help out at CurePoint Cancer Center, which is the radiation oncology center here in Dublin, Georgia. I was invited to come down and look at whether or not I thought Dublin would be a good place for me to come and practice by Philip Miles, the owner of CurePoint Cancer Center. I took several visits down here, and I thought that Dublin was a very fertile environment for cancer care. Overall, all health care is very important, and cancer care is one component of total health care. And the Dublin facility at CurePoint Cancer Center is such that it is in a great location in terms of proximity to the Veterans Hospital, as well as the Fairview HCA Hospital. And it just seemed like there was an underserving of cancer services here in the area. Not that they don't have good doctors, but it was maybe not cohesive. And I thought that there was the opportunity to add to it and to look at further expansion, not only of the providing of care to patients when they had cancer, but to look at other aspects of prevention and things of that nature that hopefully reduce the overall cancer rate in this community and throughout South Georgia. And so with that, I took up the invitation from Philip to come down to Dublin and have been here since about September. The COVID situation has impacted some of my getting out to meet people, to talk about what I can provide and add to them in terms of a resource if they had questions about patients who they wanted to get another opinion about. I interestingly met Mr. Deal in one of my visits down here, and we got into an in-depth conversation about just healthcare in general. But with that, you know, I said, well, maybe it would be a good thing to have a chamber meeting to expose not only me to the people of the community, but also to talk about healthcare in the community, because I think the business community needs to be integrated into the healthcare of the community, because that community is the source of employees and people that they're going to encounter in their day-to-day lives, be it work or just social or just the act of living in a community. And so, you know, James grabbed onto the idea and said, this is great, we're going to probably expand what we have done in the past. And so I was very excited about that. Again, COVID has been an interesting influence on all of our lives, and so that's one of the reasons we don't have a live forum, so to speak, but hopefully that will be somewhere down the road if we need it. But these moments of at least providing information and having discussion about the different parties' concepts about healthcare for not only Dublin but Lawrence County, I think is still an important thing to take off with at this point in time. At the Dublin facility, CurePoint, I deal with lots of different cancers. The one cancer area I don't deal with is pediatrics, because I think that needs a special level of care, which is best done at facilities that have pediatric support systems and a lot of other technology. But I think for the technology that I know that's here at CurePoint, we can handle most malignancies. We've got the latest technology in terms of IMRT, which is intensity modulated radiation, and IGRT, which is image guided radiation therapy. And those two modalities help to pinpoint the area you want to treat and helps you minimize dose to areas you don't want to get excessive doses. And those are very important in delivering cancer care in a state-of-the-art situation, and hopefully will add to people's lives. And if it is not able to cure them, hopefully it can alleviate symptoms that will allow their quality of life to be good. The primary cancers that I tend to see in practice are prostate cancers, breast cancers, and head and neck cancers. Colorectal and lung cancers are also cancers that I see. And a lot of that is very dependent not only on the population, but what other specialists are in that community who will end up seeing those patients in the start of their path down the road to dealing with their cancer. In this community, you know, what I tend to see right at this point in time are breast, prostate, and some lung. But by no means means that we cannot deal with those other cancers whatsoever. Relative to the process of cancer treatment, there are numerous steps that are taken, and I won't go into all of those things at this point in time, but I think it's important to know that it is not a quick 1-2 situation. When I personally see my patients, I look at them for taking care of them now and hopefully into the future, hopefully that they will have survival, and with that, you know, develop a long-term relationship with them. One of the important things that I find with cancer treatment is really communicating with the patient and their family, and even more so, not just because they have the disease, but hopefully so that they can be messengers to the proponents of good care, good habits, and prevention and early detection. Because ultimately with cancer, early detection is one of the things that gives us our edge up on hopefully being able to enhance the cure of patients who have cancer. Prevention is something that I don't do, but I educate patients on things that they can do to hopefully minimize their risk of cancer and members in their family risk for cancer. As I've talked about prevention, one of the important things of prevention or lifestyle changes is that hopefully you will not develop cancer, or at least lower your risk for cancer by doing those lifestyle changes. And of course that involves stopping cigarette ingestion and use of cigarettes, and that'll help reduce the risk of lung cancer. Also, to avoid overeating and to eat healthy, because we know that obesity increases the risk of different cancers in the population, and that's a very important thing. And I won't go at this moment into a lot of the dietary issues, but again, those are key things to remember. Is lifestyle influences whether or not you get cancer in a large percentage of the cancers. Some things you can't influence because we are human beings that have a machine that is unique to none other, that sometimes can get faulty and cancers can come about. But the key on that, because we can't always predict things, it's important to have follow-up with your doctor. It is important to have visits to your primary care physician. And you can work that out with your primary care doctor in terms of how frequently they want to see you. But the key is to get that maintenance checkup, just like you would do for your car, you do for your body, because it's the best car you're going to get. And by having your doctor hopefully go over you and do periodic testing on different areas, that will help either help you to find out whether you have some abnormality sooner as opposed to later. You know, with the effects of the COVID virus, lots of people have put off visits to their physician, and for a multitude of reasons. But one of the things, while you delay your care to seek out a problem that's going on, you're also, if you unfortunately have cancer or even cardiac disease, you are putting off your ability to get care before it's too late. Because delay of treatment and delay of getting a diagnosis, all those factors can reduce your probability of having the disease controlled and a cure. Relative to getting treatment, one of the things, as I mentioned, is that this area is in a very good area relative to being the center of the county, of Lawrence County. And there are services here that are not unique to other places, but I think it's important that people know that in this community, they have those services. They don't need to necessarily go and drive to Augusta or drive to Macon or go to Atlanta or even Savannah for those services, unless they just truly have a comfort of wanting to get a second opinion, which is always reasonable. But when it comes down to having your treatments, you have some place to go right in your own backyard. And cancer treatments can be rough, be it with radiation or with chemotherapy. And radiation may not be as rough on a person's body as chemo, but it can still be fatiguing to people. It can cause them to have various symptoms depending on what part of the body they're getting treated. But to not have to drive a half an hour or an hour in one direction to get the care and then come back home with the return trip, that just not only takes out time out of your day, but also just wears on you physically and emotionally and mentally. And you know, the thing is that you also have not a far distance, so you don't have to worry about finding a ride to drive you an hour away, because again, it takes everybody out of their, I guess, schedules, so to speak. But being in your own backyard, it makes it a little bit more convenient to get consistent care and good care. And it's not to say that you can't get good care in other locations, but again, if you have it right outside your back door, why don't you use it? I think one of the other important things is screening. And so, you know, for some patients, if they have a risk of colon cancer in their family, they need to probably talk with their primary care and let your primary care doctor know what your family history is. And not only your family doctor, let your family know what the family history is for different illnesses. And colon cancer is one of those that can be diagnosed much earlier before it has got invasive, such that you end up needing chemo and or radiation. You will definitely probably need surgery of some form, but that surgery does not have to be debilitating if the cancer is found early enough before it has spread. Relative to breast cancer, women, if they have a family history of breast cancer, it's important for them to get yearly mammograms so that that can be diagnosed and addressed much sooner. And the types of surgery that are available for breast cancer are no longer debilitating as they once were, in that you don't have to necessarily undergo a mastectomy. You can undergo a lumpectomy. And there are new technologies that are looking at maybe even not needing to do a lumpectomy in very early lesions, such that you can minimize the surgery and also minimize the time away from work. And those are, again, important factors, because we want people to maintain their normal routine as much as possible. This time period we're in, routines have been just totally disrupted, but we all need to try to focus back on routines that allow us to have a decent quality of life. And that's why visiting your doctor is very important.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
Portions of this program are brought to you in part by Fairview Park Hospital, a leader in healthcare for Dublin, Lawrence, and surrounding communities. Providing specialty services through facilities such as our Sleep Center, the Heart Center, and Women's Imaging Center.
other diseases are smoking. And if a person has a history of smoking and they're still doing it, they still warrant talking with their doctor about lung screenings and maybe to have a CAT scan to try to find a lesion, small size, that can be addressed with either surgery or some other form of treatment as is appropriate. Because again, when the cancer is small is the best chance that we have for delivering a cure. And if it is not small, it makes it just a little bit more difficult. Not impossible, but more of a challenge. So, breast cancer is one of those, lung cancer, colorectal cancer. Now, people go and they may have headaches that continue periodically, but then they get into a frequent pattern. Those are things that, could just be a headache, and not to say everybody's got a brain tumor when they get a headache. But, again, let your doctor know about the symptoms you're discussing. You can go online and read things, but again, getting the expertise of the doctor who can give you interaction with the questions that you may have, and he can process that better than a computer that you're just reading, and then you're trying to extrapolate your symptoms to what's in the computer. So again, your physician is a key part of your maintenance, just like your mechanic is on your car. In terms of the treatments of radiation, people hear the word radiation and they become frightened and they think that all sorts of things are going to happen to them. When patients are undergoing radiation treatments, in general, most treatments take anywhere from 5 to 10 minutes of actual treatment time, and patients are usually in and out of our department in 20 to 30 minutes, if that long. The longest part of the process is probably getting a patient on the table, setting them up so we're accurate in our delivery of radiation, and then it's done and they get up and go about their normal routine of going to work or going at home and kicking their feet up and relaxing and resting. So, radiation is not as arduous as chemotherapy is, which sometimes requires several hours of being in the doctor's office with infusion, getting medications via IV. But if that's what's warranted, needing chemo is definitely something that should be entertained and done. Relative to radiation, the people you work with that you come in and see every day in the radiation department are very integral to your care. And we're fortunate at CurePoint to have a very good staff of individuals who are attentive to the patients, communicate with the patients, and they're an extension of the doctor's eyes in terms of each of the patients that come through those doors. Because there may be more that you tell the staff than you tell the doctor, but that's information that's helpful for us to know what's going on with you so that we can help deliver good care. The environment with COVID, people want to minimize being around people. Well, one of the things that we have tried to do are take precautions to minimize exposure or possible exposure to the infection. At CurePoint, we do those things as well. We do cleaning processes on a daily basis. We wear masks, we have sanitizer, and we also minimize the number of people that are in the office at any one time. It's rare that you'll find more than 4 or 5 patients in our office at any one time because we space out our appointments, and if it gets too backed up, a lot of times patients will wait in their car until it's their time to come in. But again, your safety is a concern to us, but we want you to get your cancer treatments, and so we try to make it an integration into living in this new paradigm. With the virus that's here, one of the important things is for us as a community to take those necessary precautions of wearing a face mask, washing hands, minimizing exposure to large groups of people. And even though, you may be with your friends, you really cannot afford to let your guard down to say, oh, well, I know all of these people. Well, you do, but then you really don't, because you don't know who they may have met who wasn't as diligent, and therefore you may be setting yourself up for the virus to spread to you. So many times we hear about people who supposedly didn't do anything. They weren't doing this. They were being cautious. And I don't doubt that they were being cautious, but sometimes we all probably let our guards down. We just have to be very vigilant during this particular time. And a lot of people are concerned about the vaccine and, well, is it safe? Well, I would say there is nothing in this world that is absolutely safe, and you have to weigh the risk versus the benefit. And the benefits are extremely important to reduce being infected by this virus. And there are going to be some people, even if they get the virus, they may unfortunately pass away. But that's because they either, one, are immunocompromised, they have an extreme high viral load, or even more significantly, they discounted the symptoms that they had. And that's why everybody, if you have symptoms, you need to go to your physician and be evaluated. And sometimes, if you're not satisfied with what's being told to you, then you need to go somewhere else to get another opinion and not delay it a week, particularly in this particular time. A lot of times there have been people who have had the cough and they say, oh, it's just my bronchitis, or, oh, I was smoking, so it's just that. You need to just get it checked out. And if necessary, have the doctor get your chest x-ray and or CT, because the key with COVID is making an assessment that leads to possibly a diagnosis sooner than later. We know now that there are certain treatments that can be instituted within a certain time period of 7 to 14 days that helps minimize the infection if you have it. Once it passes that time, what has happened during that delay is that the virus has multiplied and starts to really invade other parts of the body, and it just makes it harder for your immune system, your army inside, to battle that virus. And that's why early diagnosis is very important with COVID, just as it is with cancer. There are immunoglobulins that you've probably heard about on the news of how your body is stimulated by the vaccine, and that's one of the very important things, because again, as I said, this is one of the most unique machines that we have. We have our own army inside, and that immune system, if it's kept healthy, will keep us as healthy as we possibly can be. And the antibodies that the vaccine helps stimulate you to make will hopefully help protect you. But there, like I said, are people who may not have had the vaccine, but there are other treatments, particularly the antibodies that are in your plasma. So Eli Lilly is a company that makes the antibodies, the antibody infusion. But for individuals that who are in your community that unfortunately had COVID, they have now got antibodies in most cases. And those antibodies can be donated via the plasma that they have. And one of the things that's now starting to hit the public airways is the need for people who have had COVID to make plasma donations. And the Red Cross and other transfusion entities can extract the plasma from your body and then store it and then give it to somebody who has caught COVID, and hopefully it's caught in an early stage of their infection so it can have an impact on the infection. Antibodies that you get from vaccine stimulation and the antibodies that you get from transfusions, what they are really hopefully doing is neutralizing and slowing down the growth of that virus until your own body's immune system can kick in and start making your own army against the virus. So again, it's extremely important because, there have lives that have been lost because of not having the information and not being aware. So, people sit around and talk about different things, but if you don't really know, don't spread false rumors, go and get the factual facts from your physician or other healthcare providers. The American Red Cross, I believe, is going to be coming into Lawrence County to initiate drives for plasma donations. And I think it's important that if people have unfortunately had COVID but have recovered, they should seek out the Red Cross to see if they have antibodies that they can donate. And when you donate your plasma, it doesn't mean that you have put yourself more vulnerable for the virus, because your main army are your immune systems, the T cells and the B cells, because they can go back into production to make more if you were to be introduced again to the virus. So giving up your plasma is not disarming you and making you more vulnerable. And so it will be very important to consider that. I know in Atlanta they have now started marketing that on the airwaves. Sometimes you're not going to really hear commercials about plasma donation, because right now it's an emergency use treatment. And Eli Lilly, even though they manufacture it and it's on a lot of shelves in hospitals and pharmacies, it's not something that a patient, one, knows about, but if a patient asks for their doctor to consider that, it's something that can be considered. But Eli Lilly can't go out on TV like you see so many medications being advertised to advertise for it, because again, it's still being classified as experimental use or emergency use, and they are just restricted by law. But your awareness and knowledge that such things exist is important for you to be your own advocate as well, and at least put it out to your doctor to let them help make an assessment whether that would be something beneficial for you. One of the points that I've talked about is about the vaccine. And there's lots of skepticism. There's all these rumors about you're being tagged with some marker or some chip so that they can track you. And those are very creative and colorful ideas, but there's no foundation in that. There's been a lot of challenging comments made about the virus not being real and being a hoax, and I'm not really sure why anybody would absolutely feel that way, because unless they have done their own research, they have no proof of that, and they're just getting hearsay from somebody else. And I find it fascinating that people want to discount the science. But if we discount the science, then are we discounting how when we flip a switch, the light can come on? Do we discount the fact that when you're putting gas in your car, that it's getting into your car and causing a bunch of reactions to go on that makes your car move? Well, science exists in all disciplines in our life, and our healthcare is where some major science is going on. We are sending people to the moon and beyond, and our science continues up there, but we're applying it in a new environment of space. And how does gravity affect things? So yes, we do not know all answers, but we want our culture and our society and our human race to survive. And so science is something that we have to rely on. Vaccines are real. They're real for a purpose to help promote health and life. Smallpox, I remember when I was a child getting my smallpox inoculation, and they did it in school. And it's very rare that you hear of any smallpox outbreak in a industrial nation. It does happen rarely in some countries, but vaccination prevented that. And the significance from my standpoint is I had a relative, when I didn't know her because I was young or not even born, who died of polio. And so most people, I tend to think, know that this virus is real. But some people, if it's never crossed their life, they tend to discount it. But I think, unfortunately, the more people that end up getting it, more people will have a recognition of that. But the stories that we see on TV, be it the news, clips, or whatever, those are real stories. And doctors and healthcare workers, we are concerned about everyone's health and even ours. And we want to minimize our exposure just as much as you minimizing your exposure to the virus. And if you have loved ones, you should want to protect them as well. And so it's not a matter of being Superman or machismo, but wear a mask. It helps reduce it, independent of what your buddy said or your girlfriend said. It doesn't do anything. Just as a common courtesy, when you were growing up, you were probably taught to always put your hand over your mouth when you're going to sneeze or cough. Well, now this mask is going to not eliminate your need for doing that, but it gives you a head start before you sneeze or cough, because you will be propelling germs in the air. And this virus, COVID-19, is a virus that you don't want to be spreading to anyone, and particularly your loved ones. So again, we are truly all in this together, and it's extremely important that we look at the community as a whole, not just the people you see day to day, but some of the people you don't see.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
I'm Darin Keene with Clements and Keene Insurance. We all know health insurance has been a hot topic for many years. Unfortunately, the discussion usually leads to many misconceptions. I wanted to clear up some information that you may have heard that might not be true. First of all, most people believe health insurance is always too expensive for them to purchase. This may be true in some scenarios, but thousands of people in our viewing area could apply for advanced premium tax credits to lower their premiums, sometimes as low as $0 per month. So if you do not have access to group health insurance through an employer, or if you're not eligible for Medicare, please give us a call at 478-272-8019 and get the facts.
Welcome Denise Forbes, CEO, Community Service Board of Middle Georgia, to speak with us about mental health.
Hello everybody, I'm Denise Forbes and I'm the CEO here at the Community Service Board of Middle Georgia. We are actually your community mental health center. We serve 16 counties in our rural, central, and eastern part of Georgia area. Dublin happens to be our headquarters, and I am very thankful today to be a part of this 2021 Voice of Healthcare Virtual Summit. You probably noticed that I had a mask on as I was getting ready for my part on the summit. A couple of people here that are filming do have their mask on. We have been extremely vigilant here at our agency in encouraging our staff and our clients and any visitors on the property to make sure that they follow the 3 W's, as Dr. Thomas Kraft has encouraged us to do in our community. Wear your mask, wash your hands, and watch your social distance. So for ease of discussion today, it is easier for me to talk without the mask on, so I hope you'll understand and indulge me in that at this point. I wanted to start out today and talk a little bit about a couple of things around our coronavirus epidemic or pandemic, and speak a little bit to some statistics on suicide as well. But in the spirit of the Healthcare Summit, we also want to make sure that the things that we do bring to you today is how we have, as a community service board or a community mental health center, how we have been able to try to help people during the pandemic, and also how we have gone about treating the whole person. It's a very important topic, and it's something that we ascribe to here. Hopefully, as we continue on through our discussion, you'll be able to see some of the important work that we've been able to do. As far as the coronavirus pandemic and how it has really kind of affected not just us, but agencies like us across the state of Georgia and the nation, we all have read enough and seen enough that in the beginning, mental health agencies and hospitals were a bit unprepared. It sort of caught us a little bit unaware, and not a lot of us around had certainly had a lot of experience, or any experience for that matter, in dealing with something of this nature. And it came on pretty quickly, and we've learned a lot day by day, week over week, and month over month in terms of how to try to work within the context of having to deal with a situation that has taken us all by storm. Some of the things that occur or have occurred with some of the people that we serve, our families, our community at large, is that during this pandemic and continuing through these months, there's been people who have reported an increase in isolation and fear. It could be your fellow citizen, or it could be a neighbor, it could be one of your family members. But if you talk to people, it's really the forefront of the topic of anybody's discussion these days is how are you doing during the pandemic and what's going on, and really how is it manifesting with you. And that in and of itself, we know that we've had to deal with the physical side of what the virus has caused, but because of the isolation and these type of fears or anxieties, we also know that it did set up a perfect storm for what we have learned to understand it as the kind of like a shadow pandemic. There's been increased reports from people of more depression or having depression, people that have never had it before, or anxiety, or increased use of substances, whether that be drugs or reliance on even prescription drugs in an inappropriate way, or illegal substances. The post-traumatic stress disorder complaints have also increased, as well as have reports of suicide. And just to kind of bring that together, the Substance Abuse Mental Health Services Administration that we know typically as SAMHSA, they have a hotline that you can call anytime that you have a problem or a concern. It's a national hotline, of course. They tracked numbers between April of 2019 and April of 2020, and the calls that they received increased by 1,000%. Many of those having to do with the concerns that I've just mentioned, and particularly around the fear of how they're going to deal with the problems with the pandemic. In Georgia, there have been a number of agencies that have been forced to completely shut down. And in other agencies, more than not, there have been situations that have been set up where programs have had to shutter. Some programs have had to completely shutter. Maybe not to last forever, but until you could get a grip on what was going on and how you were going to handle that. And even at our agency, we've had to figure out how to work within that. We have had to shut some of the face-to-face services down, and particularly early on, and any time that we've had a spike in our numbers, we've had to try to sort of revamp and take a look at what we needed to do next. I did mention that it's been kind of known as a shadow pandemic because you have a lot more worries, concerns, and even behavioral health symptoms again being displayed. In a fairly recent Kaiser Family Foundation survey, 1/2 of the Americans that actually completed the survey suggested that the pandemic had caused some harm in their mental health. There's also been, again, the economic upheaval that some people have either witnessed or experienced personally, or had a family member or close friend that has experienced it because of situations with jobs where there have been layoffs, or where, again, some agencies or businesses have closed. And again, the isolation. And this continues on to this day, and mainly what we're here to do is to try to figure out and do the best we can at trying to meet the needs of those who might be having some of those concerns. So really, what has the CSB of Middle Georgia been able to do during the pandemic? One of the things that I want to do before we go further is to really give a shout out to our department, the Department of Behavioral Health and Developmental Disabilities, and also the Department of Community Health, which is known as DCH in the state of Georgia, and also on the federal level, the Center for Medicare and Medicaid Services, CMS. One of the real early on things that all three of these agencies, it moved from the federal over to the state, but very quickly they helped us be able to relax a lot of the pretty stringent regulatory standards and expectations that we have to go through, and opened up not just telehealth in a much more broader capacity and opportunity for us to utilize, but also allowed us to use telephonic, where even if you didn't have the visual with the individual, if you could get them on the telephone, and many of y'all might understand that in a rural area that covers the expanse of the counties that we do, over 16 counties, where we have a lot of poverty and a lot of people that do have struggles with economic resources, that there are people still here that don't have smartphones and sometimes don't even have a cell phone. But most people can get access to a phone of some kind, and it does allow us to continue to be able to connect with that person on a telephonic level.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
I'm Don Carswell of Dublin Chevrolet. The new year means new savings on your favorite Chevys.
Dublin Chevrolet saves you up to $7,000 off MSRP on this Silverado Crew Cab.
And remember, Don sells cars well, only at Dublin Chevrolet.
The other thing that it might be interesting to know is that everything from the immediate point where someone comes to access services that we call our initial intake or evaluation, intakes, the nursing services, our physician and psychiatric evaluation services, our counselor appointments with our therapists and licensed staff, our case manager visits. All of these services have been allowed for us to bill and provide on a telehealth basis. The next thing that I want to mention is when we're looking at treating the whole person is a program, or actually it's really an embedded piece in some of our peer support programs, but it's called WHAM, and that stands for Whole Health Action Management. And within that service array, we're able to focus on an individual's behavioral health needs, their physical needs, their spiritual needs, their financial needs, any type of educational support, and also their family situation and what needs that there might be out there, and anything else that really touches that person in terms of a need. WHAM builds on or builds skills towards self-management in a holistic platform, and it considers both the chronic physical health and the behavioral health needs of the person. So it really is looking at the whole person. Whole health serves the entire individual. It has two components. One is a person-centered planning approach that creates a concise whole health goal to begin, for the individual to begin self-management. So that's really the goal. You know, you want to take a look at what concerns you might have, and then you want to teach someone the skills to be able to manage that problem. So in a self-management platform from that time forward. And the second component is developing a mind-body resiliency to promote the self-management skills. During any of our initial evaluations, as you walk in or call in to the clinic for services, we pay attention to the individual's physical health needs. And we are very, very thankful that we live in a community across our 16 counties, but particularly in our hub communities of Laurens and Manuel, that do seem to be a regional resource for physical health needs. We have a very collaborative approach, and we refer very often to local physicians, to our urgent care offices in our areas, and to our area hospitals. And we appreciate that collaborative approach again that exists between our agency and the physical health organizations and agencies that are here to support the community as well. I also want to just mention that our WHAM services are provided in our peer support programs, and those would be our Spark program that's at our Independence House location here in Dublin, our Monarch peer program, which is in our Manuel County Clinic in Swainsboro, and our Spirit program, which is also based here in Dublin, but is also a co-occurring program or a dual program that looks at the needs of someone who has intellectual and developmental disabilities, also co-occurring with behavioral health concerns. So those three programs primarily utilize WHAM, as does our the emerging adult programs based here in Dublin, which is known as the DEN, and our emerging adult program, which is based in Telfair County, known as the Hub. The third topic that I just wanted to mention today has to do with suicide prevention, and I wanted to sort of give you a little timeline and some historical data regarding the state of Georgia. Georgia was actually the first state in the nation to come up with a suicide prevention plan, and that occurred in 2001. It has been updated a number of times through the years, the latest of which was in 2020. When we look at suicide prevention or the risk for suicide, we look at what we consider risk factors, and having a mental health or a substance abuse concern or illness does pose a significant risk factor for suicide. Additionally, there are environmental factors that we look at. Any type of a stressor or a stressful life event might be an environmental factor to consider, or access to lethal means like firearms or drugs. Additionally, a previous suicide attempt or a family history of suicide may become a risk factor. There's a term that we use, we say means matter, and the means do matter. And so if you have someone that you suspect might be at risk for suicide, then one of the things that we would suggest is to make sure that you remove any weapons, particularly firearms or any kind of drugs at the disposal of the person, and get those out of the way, because without having a means, it makes it more difficult for someone to actually carry out the act. We look at the numbers the most recent numbers that we have right now for suicide in the state of Georgia, and those would be from 2018. But during that time, 1,565 Georgians died by suicide. 63% of those deaths included the use of a handgun or some type of firearm. If you want to break it down further, that is about 30 deaths a week, and it does break it down even further than that to around 4 deaths a day. So just think about those stats, when you're thinking on a day-to-day basis that we might lose 4 of our fellow citizens per day to suicide. Out of the number, 78% of the deaths were men. And the particular ages where the risk was seen, or actually the death by suicide was the largest number, were from the ages of 25 to 29, 55 to 59, and 70 and older. 22% of the suicides were female, and the most significant age group that was affected by was 45 to 49 years old. The average suicide rates are higher in rural counties than they are in our metro areas. Metro areas obviously would have more deaths because the population is larger, but the rural counties, the rates were higher. Suicide is the 10th leading cause of death in Georgia. It is the second leading cause of death in our young people aged 10 to 24. And the Georgia suicide rate is 15.1 suicides per 100,000 population. If you want to look at those numbers a little bit more, kind of dig down into the details a little bit more, there was a 2020 United Health America Health Ranking Report. New Jersey held the best ranking in the number of suicides in the nation, and their number was 8.6. Wyoming finished up our 50 states with the highest ranking at 25.8. Georgia's ranking again was 15.1, so we're somewhere kind of in the middle. During the pandemic, there were lots of goals that we looked at, but for suicide prevention, 3 of our top goals were to make sure that we try to educate the community to understand and have a better increased knowledge of signs and factors that might contribute to suicide. We also want to make sure that we have educated our community in the ways of knowing how to reduce access to lethal means. And the third goal was to expand evidence-based trainings for gatekeepers and clinicians. And that training that we use here is Question, Persuade, Refer. It's known as QPR. It's free for the asking. We have a number of trainers on staff. Renee Avery and Tina Clements, Connie Smith, I think, are 3 of our trainers that have done a number of trainings across time, and even during the pandemic, we're able to do that through Zoom. So if you or your agency or you know any other church or faith-based ministry or organization that would be interested in doing QPR or knowing a little bit more about it, then just give us a call here at 478-272-1190 and ask for Renee Avery, and we will be glad to do what we can to set up a training for you or anyone that you know that might be interested. I'll mention our Voices of Hope Coalition, which we've had in our area. It's a suicide prevention coalition and a very collaborative group of people that has worked diligently over the years to try to make sure that we do bring attention to this very important training need and important situation and concern in our community. But one specific thing that I think might be noteworthy is while we have always tried to educate along any of the lines of suicide prevention, for our beginning, when we began the coalition and on into these last several years, our focus has always been our youth, and our children and youth. The last year, we decided to focus primarily on men. And interestingly, as you will remember, this is the actual category of individuals who actually have some of the higher rates of suicide across Georgia. So we appreciate, again, being able to be here today and to bring you a little bit of what we are trying to do in terms of showing the whole health needs of a person.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook. When the power's out, you're out of business. But with natural gas, with the City of Dublin, when the power's out, you can still cook on your gas stove, or shower with your gas hot water heater, or even fire up the grill. Plus save money every single day, because natural gas costs half the price of electricity and propane. Start saving today with the City of Dublin Natural Gas. Call Brad Grimes at 277-5048 and you'll never be out of business with natural gas.
Welcome to the show, Darin Keene, Clements & Keene Insurance Company, and Darin is going to provide some great, valuable information for us today concerning the state of healthcare and healthcare insurance.
I'm Darin Keene with Clements & Keene Insurance, and we're happy to be a part of this today. The question would be, that we first start talking about is the Affordable Care Act. A lot of people talk about it. You hear it in the news. You hear business people talk about it a lot because it's changed how they've needed to provide benefits to their employees. But the biggest part of it is people who do not have access to health coverage through the job. So those people would need to buy what we call private or individual insurance. And where the Affordable Care Act may have changed the landscape, it's actually provided a way for those individual policyholders to apply for tax credits to lower the premium. In some cases, the premiums have went up, and in some cases, they may have went up a good bit, but that's not always the case. And I would say there's probably about 70% of the people, probably right here in Dublin, Lawrence County, that do not have health coverage through their job or may not have it offered to them anywhere else that could qualify for tax credits to lower that premium. And a lot of people could lower that premium to even zero, but most of them could lower the premium to where they could afford it. So in thinking about how it's changed the landscape, anybody could come up with something negative and more people could talk about how positive it is. But I would say that a lot of people are still uneducated about it. And I think most people need to do a little more digging, a little more research about the Affordable Care Act and see how they could benefit from it. Health insurance is usually obtained through where you work, your place of employment, and that would be considered group health insurance. Group health insurance allows a business owner or a company to offer health insurance to their employees. And what happens there is the employer pays a large portion of the premium. And that's how they attract quality employees, by offering that as a benefit. Everybody wants a job with good benefits. One of the biggest things that attracts an employee is good health insurance and affordable health insurance. So that would be group insurance. And of course, we do group insurance as well. And of course, most businesses here in Dublin, Lawrence County would be small businesses. And one of the most attractive things that's on the market today, and especially here in Dublin, Lawrence County, is the Chamber Smart Plan. And it allows members of the Chamber of Commerce to get discounted group health insurance based on the size of their group. A lot of people with small businesses think that they can't pay the premium because everybody pays the same premium. But with the Smart Plan, it's based on your group. So if you got 10 people and you look at the price, it's based on how healthy your 10 people are. If you do not obtain health coverage through the group or where you work, then that is what we were talking about, the private and individual marketplace. And that's where you can apply for the tax credits that we mentioned earlier to lower the premium. Most people who have group insurance or through their work, that group or that company has an open enrollment period. Probably 80% of those groups, that open enrollment period is usually going to be November and December for a January 1 effective date. So if you work at a company, I would encourage you strongly to talk to your HR representative and find out what's available. A large number of employees may not even know what's available, and those group insurance premiums are paid, a good portion of it is paid by your employer. So I would encourage you to check with your HR representative at your company or the business owner. If you do not have health insurance offered through your job, the individual marketplace has an open enrollment itself. That open enrollment is November 1 through December 15th. During that time, anybody can purchase health insurance. Regardless of your health, it doesn't matter. Regardless of your age, if you're under 65, for whatever reason, you can purchase health insurance. And also, to get the premium more affordable, you can apply for those premium tax credits that we mentioned. For those people who miss the open enrollment with the individual marketplace, that being November 1st through December 15th, they may be eligible for a special enrollment period, which is a SEP, better known as a qualifying event. If you have a case where you might lose, a lot of people lost health insurance because they lost their job or were cut back or laid off due to COVID. That's a big impact on us right now. So if you find yourself without health insurance because of COVID, you can apply for health insurance. If you have a baby, get married, change jobs, anything like that where you may have lost coverage, that would be a qualifying event or a SEP. And during those times, you can purchase health insurance anytime during the year. All right, everybody talks about the future of health insurance. If you're a politician, it's going to get talked about on the campaign trail. And all of us heard plenty of talk about it, and regardless of where you stand on the political side of it, it could have an effect on us. And I'm not going to sit here and predict the future. Based on the information that I have, we have some ideas. President Biden just opened up the marketplace. So where we mentioned earlier that you could qualify for a SEP or qualifying event, the marketplace is now open, and that's an incredible opportunity for those people who missed the open enrollment back in the fall of 2020. So now you can apply for health insurance just like it was open enrollment in 2020. We do not know how long that will last. We don't know how many months. The reason for that is because of the COVID pandemic. And that is influencing just about every decision that most businesses are making right now. We're all trying to get through the COVID pandemic. We're hoping that the vaccine will become more available for everybody, particularly in our community. And just to mention about that, as far as the future, right now the health insurance companies and most of the carriers that we represent are paying 100% for testing, for treatment, as well as the vaccination for COVID. So, all of the major carriers that we represent, most of them are going to cover that at 100%. So if you find yourself uninsured, if for no other reason, the COVID pandemic could be a great reason to get health insurance. And right now, health insurance is available due to the fact that the marketplace has been opened up.
I'm Marcus Clements, and I head up the Senior Insurance Center at Clements & King. We deal with hundreds of Medicare beneficiaries, and we have many questions asked during this pandemic as how Medicare is covering the pandemic and the COVID. If you have traditional Medicare, or if you have a Medicare Advantage plan, in most cases the co-pays for testing, co-pays for primary care doctor visits are being waived. We would encourage you to see your physician, to go get tested if you think you should. You'll probably have no out-of-pocket expense. In addition to Medicare, we issue several other products as companions to Medicare. Medicare supplement, prescription drug plans, dental and vision plans. Several additional coverages are available that you might want to explore. But as far as the COVID pandemic, those on Medicare are actually in a good position as to have their co-pays and their co-insurance waived if they need testing or if they need treatment. We would encourage you to see your physician. If you have any question about the coverage and what's to be available to you, we're available to answer your questions.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
I'm Heath Richter, and we just want to invite everybody to come on down to the Houston Clinic and check us out at our new facility. We've been in Dublin for a while now, obviously, but have a new office here, and we'd just like you to come down and see some of the new stuff we're offering. And if you need to get checked out, we'd be glad to do that for you. We've got able to do some ultrasound-guided injections now, and physical therapy, and just a little bit better space, so hopefully we can get you in and out of here a little bit quicker.
Come by and see us today at our brand new location, the Houston Clinic, Medical Drive in Dublin.
Coming up next, it's my pleasure to welcome Dr. Daniel Avery with Optum Healthcare to the show. And Dr. Avery is going to share a little different perspective with us, being is that Dr. Avery has actually not only had COVID, but near-death experience with COVID and a really long struggle with COVID. So Dr. Avery is really going to share a little bit different approach and opinions with you about COVID today. Welcome to the show, Dr. Avery.
Hi, I'm Dr. Daniel Avery with Optum Internal Medicine in Dublin, Georgia. I'm here to talk to you a little bit about coronavirus, precautions you can take that'll save your life. I just recently had coronavirus, and let me tell you, it was no picnic. It's something that's so contagious, it's really hard to even describe. Your mask is the most important thing you can do to protect yourself, besides getting the vaccine. Right now, I'm going to take my mask off. James Deal is socially distanced from me. He's wearing a mask. He's several feet away, but it sometimes has a little bit more impact when you can actually see the mouth and the face. And it ain't a pretty face, but I'm happy that I'm still here after having had coronavirus. I've treated lots of patients over the past few months. Many of them had coronavirus, and a lot of them, they weren't fortunate as I was, and they didn't make it. I've lost about 10 patients so far to it. When I had it, I've never been that sick in my adult life. The weakness was unbelievable. I didn't know if I was even going to be able to make it back inside my house after taking the trash out. A lot of things you can kind of force yourself to go do if you've got willpower. You can kind of push through even if you don't feel good, but this was not like that. This was a physical brick wall. There was no going further, no doing anything extra. It was scary. Spent about a week, barely could get out of bed. Fortunately, my neighbors, Bill and Sil Best, cooked and left dinner for me every night. It's easy to tell patients to go socially distant and stay at home, but you know, when you're thinking on it, just actually getting the basics done when you're that weak and that fatigued is incredibly difficult. And I'm so grateful to them for being there for me and my family. There's a lot of patients that aren't that fortunate. And one thing that you can do to protect yourself and them as well is wear this mask. There's really no reason not to. I wish it had not been on an election cycle when all this really began. Somehow a virus got turned into a political issue, and masks, people got deep opinions on wearing masks, but the truth is, these are just basic precautions that we would advise for any highly contagious respiratory illness. I mean, it just is what it is. the ramifications for not doing it and catching it can be catastrophic. Now, we're very fortunate now that we actually have not just one, but 2 vaccines, extremely good vaccines that are highly effective, 90% plus, 95% plus, depending on which vaccine you're talking about, Pfizer versus Moderna. The speed at which we got these vaccines is phenomenal. What's problematic, though, is logistics of getting these vaccines out to the public. Because they have special storage requirements, it's a little bit more difficult to have people go through a processing area. Especially if those people don't want to get the vaccine. Nobody really wants to get a shot, but if you never get another vaccine in your entire lives, this is the one to get. This is a true multi-generational level plague that we have right here. We will never see another one like this in our lifetimes. The amount of people that have died last year alone was more, in the United States at least, was more than all forms of cancer combined. If we had a vaccine for cancer that we could give a shot for, everybody would line up for it. Truth is, coronavirus still hasn't stopped. If it stays on its current track, by the summer, it'll have killed more people than died in the entire Civil War, both sides combined. It is absolutely imperative for your protection, for the protection of your family, your friends, your neighbors, your community, for you to get the vaccine. Absolutely imperative. Now, the vaccine is a 2-shot series for Pfizer and Moderna. You have to get the second vaccine to be able to get really full immunity. The first vaccine does not immediately kick in, so you can't get that vaccine and go and take your mask off and go to a party. Because you can still catch it just about as easily as you could before you got that first vaccine. Only after you've had the second vaccine for a few weeks are you fully protected, or as fully as possible. And if you get that, you can save not just your life, but you can save the lives of your friends and neighbors and family as well. And I know that there's been a lot of rumors and speculation about people not trusting the government, not wanting to get the vaccines, that the government's put a microchip or something in there. But I can tell you for a fact, the government doesn't need to put a microchip in a vaccine to see what you're doing. If you've got one of these in your pocket, they already know, because they can track every movement you make with this thing. Every Twitter, tweet, email, text. They're not trying to put a computer chip in a vaccine, nor are they trying to do anything else besides vaccinate the public, period. With politics, people get big divides, and that's unfortunate, because the virus doesn't care if you're Democrat or Republican, what color your skin is, what religion you've got, whether you're man or female. It will kill all of them, period. And to not get the vaccine because of some type of conspiracy theory is just putting yourself at risk for no reason. It's putting the community at risk. It's putting your doctors at risk. I'm not the only one that's caught coronavirus by a long shot. I mean, all the folks at the hospital, huge numbers of them have contracted the virus, trying to protect the public. They're the tip of the spear. You got your ER folks, you've got your respiratory therapy folks, you got your pulmonologists, Vishal Agarwal, Craig Rosebrock, you've got all the ICU staff, you've got Don Nelson with infectious disease. Help us protect our medical folks, because they're getting sick. Dr. Manny Vega, he just gave his life protecting the public, trying to protect the public. You really, really need to think about how not getting it could not just affect you, but how it affects everybody else. Because we lose these people. I mean, we've lost tremendous resource for the community. I can't say just how badly a hole, how deep of a hole is left after Dr. Vega passed. He literally treated hundreds of my patients over the years. Please get the vaccine. It's just simple, it's quick, it's easy. I got my vaccines and I didn't feel a thing. I wish I could have gotten it before I got coronavirus. It would have been nice, but that wasn't the way it played out. And if what I had is a mild case, I can't even imagine the horrors that these people go through with a severe case.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
I'm Don Carswell of Dublin Chevrolet. The new year means new savings on your favorite Chevys.
Save $2,500 on the Chevy Trailblazer RS.
And remember, Don sells cars well, only at Dublin Chevrolet.
And unfortunately, because of the infectious nature of what we're trying to vaccinate against, and people don't really see these folks when they're going through the torment of a really bad case of coronavirus because they're in ICU. And that's a sad thing too, because family can't see them. The public doesn't see them when they're hooked up to all those machines and they've got IVs coming out of every part of their body and they're on dialysis and their heart's failing. They don't see that part because they're not allowed to, because they will contract this stuff because it's too infectious. But if they did see it, they'd be racing to get a vaccine. And I've lost patients. They were my friends. You know, you treat people for years and they become like family, and it's just tired of seeing them pass. And I don't know if you've looked around lately and watched all the graveyards and whatnot, but you might want to take a look. I was taking my little girl to school out Northwest Lawrence Elementary not long back, and my little girl said, "Hey Daddy, are they having a party out there?" There were 5 funeral tents in the same graveyard, the same day. You show me where in Lawrence County we have 5 funerals before coronavirus in all the cemeteries in a single day. But that was one cemetery, and every day we pass back by there's another and another, multiple ones. You could ask your funeral home directors, how bad is this? They'd tell you flat out they'd never seen anything like it. Out in California, they're on a waiting list just to bury their dead. It's something that is just almost unfathomable in today's times. And we can bring this thing to an end with the vaccine and using a mask. What we don't want to do is overwhelm our critical care capacity, because when that happens, people start dying of left and right. If you need oxygen and you can't get a vent, that's the end. If you have something else go on, unfortunately, you'll die of that too, because these people that go on these ventilators with coronavirus, they stay there for weeks, sometimes months. If all your resources are tied up in treating the coronavirus patients, well, let me tell you, regular stuff doesn't stop happening, like heart attacks, strokes, kidney failure, motor vehicle accidents. That stuff still goes on despite it being in the middle of a plague. But they've got nowhere to go. And time can cost lives. If there's no resources here to take care of the day-to-day stuff that's common, the day-to-day stuff starts killing more frequently. The best thing you can do to not overwhelm our critical care capacity, just wear a simple mask. The virus is not a political issue to me. It's a force of nature. And in a force of nature, sometimes you got to try to control it, like a river with levees. If you don't have the levees, the river floods, destroys property, kills people. If you got the levees, you're safe. This is your levee. Because if you contract coronavirus, it'll sweep you away. And there'll be nothing left in a lot of cases, besides an empty home. Another important thing you could do to help out during the coronavirus crisis is, if you've had coronavirus and if you've gotten over it, is donate your blood. They will get the plasma from your blood that you donate and use that as convalescent plasma to treat people that are critically ill with this disease. It saves lives, and it is in very, very short supply. And if you can give that blood and save a life, it's a miracle. One thing else I wanted to mention too is the folks down at the South Central Health District with Dr. Kraft. I mean, they have done a phenomenal job. I don't know how they've weathered the storm with all of this, but it's impressive, and I'm grateful to them. I don't even know what to say, what we'd do without having them here at this point in time. I think they've done fantastic. To donate your plasma, to donate your blood so that they can obtain the plasma, you can go on the Red Cross website that you see here on your screen, and to get your coronavirus vaccines, you can go on the South Central Health website that you can see right here, right now. It's better to go online and do this, because if you call, they are overwhelmed with calls. Please go on the website to arrange to have your vaccination for the coronavirus. And thank you so much for getting vaccinated and wearing your mask. One final thing I'd like to say is I know we're really focused on coronavirus right now, but please don't neglect your other health problems entirely because of coronavirus. And by that I mean you still have to take care of the day-to-day things that still kill lots and lots of people. You know, if you're having chest pain, shortness of breath, that needs to be addressed. Not 6 months from now, but right now. And if you have health issues and you've got doctor's appointments, the doctor's offices have protocols in place to where we can sanitize after each and every patient. It's actually safer to come to a regular checkup with your physicians than it is to go and eat in a restaurant or gather together in any enclosed space with a lot of people for a prolonged period of time. It doesn't have to be a restaurant, it can be anything. So please don't neglect your regular health issues. Do follow up with your doctors as directed. If you've got any acute issues, you need to call your doctor and let them know. Don't sit and try to tough it all out at the house because you might not make it. We want to be able to get through the other side of this corona crisis, and we want everybody to do what they need to do to protect themselves. One thing is not to neglect yourself because of the coronavirus. And if you're out and about and you wear your mask, that's doubly important. I mean, if you're going about your day-to-day business. But I will say this about prolonged contact with a group. If you have prolonged contact with a group in any enclosed space, there needs to be at least some airflow. Open a door and a window so that the virus doesn't build to a critical threshold in the air in the room. If you have an enclosed space, it's kind of like smoke. It builds up over time. And then at a certain saturation point, the mask can't filter enough out for you not to catch it. It's easier to crack a door and a window and wear a jacket than it is to wear a toe tag.
Portions of this program are brought to you by CurePoint Cancer Treatment, 2406 Bellevue Road in Dublin. At CurePoint Cancer Treatment, we're bringing you state-of-the-art cancer treatment right here at home. CurePoint Cancer Treatment. Check us out on Facebook.
In today's health insurance landscape, you've probably been involved in many discussions, and some of the information you've heard may not be true. I'm Darin Keene with Clements & Keene Insurance, and we want to help you know the facts before you make a decision. Many people believe that their doctor or hospital may not take the plan that they get. We help you find the plan that has the highest level of doctor and hospital participation in your county. We're appointed with all the major carriers on the individual marketplace. Please give us a call today at 478-272-8019.
Well, hopefully this session has been informative and thought-provoking, and if things come to mind, I think it will be important to reach out to any of the panelists that have been on this meeting, and we look forward to getting input and hopefully providing further direction in terms of your health and those that you know in this community. And again, I'm Dr. Erich Randolph at CurePoint Cancer Center.
I want to say thank you to all our partners today. Thank you to our expert panel today. I know you guys are and ladies are busy, but thank you so much for your continued efforts and your outpouring in the Dublin-Lawrence community. Again, from the Chamber standpoint, thank you to TV35 for this valuable programming and the partnership that we were able to join together and provide this to make today and every day a great day for business in Dublin-Lawrence County.